Paralabral cysts are fairly common around the hip joint, and they are caused by an underlying tear of the labrum. So what we're looking for is a hyperintense encapsulated structure, which is lying adjacent to the labrum. The pink arrow here is demonstrating the paralabral cyst. So this portion is extra-articular, so it's outside the capsule, and it arises from an underlying tear of the labrum. You may or may not see that tear. Here, it's possible that this is the part of the tear, but underlying here, there will be a tear. That's where the cyst is traversing through that tear and going into the paralabral space. You can see that the underlying labrum here is also degenerate. It's intermediate, increased in signal. And so there are two things to look out for with paralabral cysts. One is that they may not actually be right next to the labrum. They can track quite a long way away from the hip joint. So make sure if you see a cyst around the hip joint, follow it back, look for a neck that is extending back towards the joint. The other thing is that you may not actually see the underlying labral tear. So in this case, we don't really see the tear, but we do know that the tear has to be present. So if there is a paralabral cyst present, will be an underlying tear of the labrum.